From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin Treloar. You've probably heard all about jawline filler and skin tightening treatments. But if you're looking for real definition in the lower face and neck, there's another option worth knowing about: deep neck contouring. Today, we're talking to Dr. Prem Tripathi, a double board certified facial plastic surgeon, founder of Bay Hills Plastic Surgery located in the San Francisco Bay Area. He's a go-to expert in facial balancing and contouring. So if you've been curious about this popular procedure and want to know if it's right for you, Dr. Tripathi's got the answers. Let's dive in. Hi, Dr. Tripathi. I'm so thrilled to have you here with us today for the Care Experts podcast. We're going to be talking all about deep neck contouring.
Yes.
I'm so curious to know, do people generally come into the clinic asking for this procedure, or do they come in thinking that they need something else and then you end up talking about deep neck contouring?
Yeah, that's a great question. I would say 5 years ago, nobody came in asking for deep neck contouring. I think most people think there's liposuction for the neck and then a facelift, and they're not sure that there's anything in between.
Right.
I'd say maybe in the last year or two, people are now understanding more that the neck portion requires sometimes a bigger step. And so the consumer is much more savvy now. There's social media, there's YouTube, all these things that people learn from, but it's still a poorly understood topic. And so most of the time we're still kind of walking through all the options for the neck. And this is one that comes up frequently.
Amazing.
Yeah.
We're going to dive into exactly what it is.
Yeah.
But before we do that, what's the most surprising thing about deep neck contouring?
I would say that most people don't realize that this is an age-dependent surgery. So once you are in about mid-40s or so, you're looking at also treating the mid-face, so a face and neck lift, or what's traditionally called a face and neck lift. But deep neck contouring is reserved for patients on the younger side that don't need skin removal at the same time. And so for those patients, we're really just doing a lot of manipulation under the skin, and we're not cutting skin out. So it goes pretty well for the younger group.
Okay, amazing. Yeah. Well, I'm so curious. What exactly is it?
Yeah, so deep neck contouring involves looking under the skin and contouring the multiple muscle layers, multiple fat layers, even sometimes the glands underneath those layers, the submandibular glands under your neck. And so by contouring those areas, we can get a much tighter control of the neck in the midline and even along the jawline. So it's really about the release of that muscle, sort of what's tethering that muscle down and then resuspending it along the jawline. That's where you get the dramatic impacts of a sharper jawline, a sharper neckline, and it goes leaps and bounds above just traditional liposuction, but not to the point necessarily of changing anything in the mid-face like a face and neck lift. And the incisions are a lot smaller.
Okay. So when I think about liposuction,
Yes.
I think about the removal of fat. And what you're saying with deep neck contouring is that we're actually adjusting the muscle.
Yes.
Are you touching any of the fat in that area as well?
You are too, yeah. So if there is fat there that needs to be removed or sculpted, we can do it, but we're really looking at the fat in real time. So when you do liposuction, you're taking a cannula and you're inserting it through a very small incision. You're running that cannula through the entire neck. But with deep neck contouring, you're opening the incision up and looking right under the skin at all the different compartments. And so it's much more tailored to what the specific patient's concern is and what's actually causing that fullness in the neck.
Wow.
Yeah.
You mentioned an incision around the jaw line. Where exactly is this work happening?
So some doctors will do the incision just under the chin. And so they can get most of the work done just with a small incision under the chin and nothing around the ears.
Okay.
Some surgeons, if they want more sculpting around the jawline, will make an incision right where the earlobe meets the face and then behind the ear. So it's still hidden. It's not a very big incision and it's not as big as a facelift incision, but it does get access to that lateral part. So your jawline can get a lot more sculpted there.
Who is generally coming in to have this service?
There's two demographics of patients. I would say some patients who may not have a lot of fat in the neck, but have laxity or feel like they have a double chin.
Okay.
And so they're looking at themselves in the mirror or they're looking down and they feel like there's bunching there, but they aren't really patients that are liposuction candidates because they don't have fat there, or they think that they are, and they're definitely in the younger group. The other set of patients are the ones that have tried treatments that dissolve fat, like at fat injections, or fat dissolving injections. Patients that have tried skin tightening treatments, patients that have done threads or other treatments that have not addressed their primary concern. Those are the patients that are like, look, I've tried everything. It's still lax. what do I do now?
Gotcha.
Those are the two main groups that I see.
And how would you know whether or not you needed liposuction or something like Botox fillers or this deep neck contouring?
Yeah, it's a good question. Botox and fillers primarily don't do a ton for the neck.
Okay.
Botox can treat a little bit of the jawline and a little bit of the neck musculature. But in terms of really like sharpening the neck and jawline, it doesn't do a whole lot.
Yeah.
And fillers can create a jawline from a smaller looking jawline. But if your neck is full, that's just going to make everything look bigger, and it's not really going to create the contrast that you want. Liposuction is a little different. If there's fat truly underneath that area, and that's all there is, a small pocket of fat, you're generally a good liposuction candidate, assuming that your skin is going to bounce back in your 20s, maybe early 30s.
Okay. I'm so curious with GLP-1s
Yeah.
being so popular now and individuals losing weight, they may find that they have some loose skin in that area. Is this something that would be supportive for them, or do they need more of a neck lift, facelift?
Good question. I mean, the neck contouring is a modified form of a neck lift. So for some of those patients, definitely. But, every day I hear patients say, hey, no matter at my thinnest weight when I was 20 versus now, I've always had this double chin, or I've always had a web between my neck and my face that I don't like. And so we're definitely seeing an increase in neck related procedures because of GLP. When people lose weight rapidly, they notice it more.
Yeah.
But I think it can support those patients, but you're always going to have those ones that have just said, look, I've always looked like this. Genetically, my mom, my sister, they all look the same.
Yes.
And I just want more definition.
Let's talk a little bit about the procedure and what's involved with that. How long does it take? What is the healing process like?
Yeah. So the procedure is done in the operating room under anesthesia. So I think that's the most comfortable way to perform this procedure. Different doctors have their cocktail of anesthesia. It can be light sedation versus general anesthesia.
Yeah.
And the incisions are made under the chin and around the ears. That's also dependent on the surgeon. After the surgery, which can last 2 to 4 hours depending on the procedure, you're wearing a neck wrap for maybe a week.
Okay.
Some doctors put drains in that get removed after about a day or two. But truthfully, the actual downtime is only about a week-ish of bruising and swelling. So after a week, maybe a week and a half, you can go out in public. Most people wouldn't know you had anything done, especially if you can wear your hair down. And then the bruising starts to go away. The scars take their time, but you're back and up and doing things within a day or two.
Wow.
Yeah.
And during that recovery period, I'm guessing you're not working out, you're being mindful of any water that you're getting on that area. Anything else that people would need to be aware of?
I want my patients like up and, out the next day. So I want them up, walking. But the thing that I
Really?
do restrict a bit is twisting of the neck because that muscle is sutured right down the midline.
That makes sense.
Yeah. But otherwise, like basic exercise, like light weights, I still have them do. It's about 2 to 3 weeks till I have them go back to strenuous exercise.
Okay, so it is really quick recovery.
It's quick. Yeah. And I have patients shower the next day. You can get water on it, just dry it off and put your ointment on.
Wow.
And so these incisions heal really well.
What would you say is important to look for in a surgeon who's doing this type of procedure?
Yeah, I think the main thing is looking into a surgeon that does this frequently, right? Plastic surgeons, facial plastic surgeon, oculoplastic surgeons, we all have our expertise.
Yeah.
And some of us are super laser focused on one procedure or maybe a set of 2 procedures. So it is important to go to someone that does these more frequently. Obviously, evaluate their portfolio before and afters. And if you can, I always offer my patients that they can talk to that have had similar surgeries so they can at least get an idea of what it's like. Those are all nice things. And then remember, after surgery, you're not done. You still have the postoperative period. You got to make sure that the office staff is your biggest advocate as well, because they're going to walk you through the post-care. Is that surgeon going to be a point of contact for you? Are they going to pass you off to someone else? Which, for better or worse, that could be great, or it may not be the best fit that you're looking for. So there's a lot of downstream stuff that you also have to remember. Just having surgery doesn't just end there.
I'm so curious, after people have something like this,
Yeah.
how do they feel? Like, what do they say to you when they come back after a couple of months?
After a couple of months, there's a big change. I think the first few days, I talk to patients about like the facelift or neck blues. Like you get a little bit down because you're not, seeing friends and family, and you're looking at yourself and you're looking a little scary. Totally understand that. But 2 to 3 months later, patients really feel just like it's one less thing that they have to think about every day. You don't realize like the weight that it has on you when you're taking pictures, when you're going out in public. These are things that bother you from an angle. And we just live in a society where lots of pictures are taken at
Yes.
unflattering angles.
Yeah.
And when you have one less thing to think about, people just have more confidence back. You see those patients walk in the door very differently than they did at their consult time. Yeah.
What would you say in general is the healing time? Like, is it fully healed, all swelling's gone after 2 to 3 months, or is it more like a year-long process?
Yeah, that's a good question. I would say 2-ish weeks until you're back to work and presentable. So you could go out to the grocery store and most people wouldn't really know that you had something done. 2 to 3 months till you really look your best-ish. But I still say 6 months for your final result. Because
Okay.
the body just takes its time to swell, to change. Sometimes the neck will be a little fuller at 2 months, and then 6 months down the line, it's flattened out. But 6 months is sort of like my benchmark for, hey, most things are done at this point. Yeah.
What does it require in order for them to continue to see great results?
Yeah, I mean, this is for all intents and purposes, a permanent surgery. That muscle, even in 20 years, will be tighter having had done it than not.
Yes.
But I still offer all my patients radiofrequency skin tightening treatments at 4 to 8 weeks. And then again, sometime between 3 and 6 months. That's just something I want to do to increase a little bit of that skin contracture around that new structure. It's probably not necessary, but I do think patients appreciate it, and it does give you a little bit of better result, in my opinion. And these are things that you can do in the future to help maintain those results. But even things just like taking care of your diet, exercise, cosmetic patients in general tend to already do those things because they, want to take good care of themselves. These are all things that will just enhance your results long term.
Amazing.
Yeah.
And is it a surgery that you're going to have the results forever? Or are you coming back in 10, 20 years to do it again?
Yeah, I tell patients that, all surgeries in the face, for example, they are permanent, but we can't stop the aging process. So it's almost like you've sort of reset the clock. But if you had a twin and you did the surgery and they didn't, even in 20 years, you'll look better having had something done. But I can't stop the aging process, nor do I have a crystal ball. So the odds of wanting something in 20 years are probably high because you've already had something done.
Yes.
But it's not necessary. So I will say that at that point, you may desire a face and neck lift, or brow lift, or other procedures, but the neck will always be tighter having done something.
If somebody's considering a facelift, lower, upper, is that something that they would do at the same time as having deep neck contouring, or do you want to stack those treatments at different times?
Yeah, it's really dependent on the age of the patient and what's the goal, right? So a facelift, most people think goes from like the top of your head to the collarbone. A facelift is really just from the mid cheek down. So that muscle that we're contouring attaches at your collarbone and then goes to about your mouth area and then connects to the upper part of the face. So if I do a facelift, by default, it includes deep neck contouring. I always do the face and neck together. Most facial plastic surgeons do both together. And that requires me removing skin. But for the vast majority of people that just want neck contouring, that are about in their 30s, that aren't really candidates for facelifting, it can be done on its own, and a facelift can be done when they're ready for it.
What about doing chin implants? I know if somebody's looking for that snatched jaw, that might be something that they're interested in as well. Would you do that at the same time as the deep neck contouring?
Yeah, it's very patient dependent. So if patients have smaller chins, just by contouring the neck, by default, their chin is going to look better.
Right.
But for the right patient, a chin implant, especially a nice contour chin implant that fits into the little shadows and hollows about what bother them, those can look really, really nice. But part of the deep neck contouring is actually even moving the voice box back so that you get more of that deep angle between the chin and the neck. And so by default, the chin and the neck line just look better.
I have some Ask Me Anything questions for you. My first one here is, I already do Botox and filler in my neck. Can those be combined with deep neck contouring, or is it better to space them out?
It's a good question. I think the thing to remember is that Botox and filler all have their place. Surgery, it has their place. And there's some overlap with what these treatments can do. But Botox and filler don't replace surgery, and surgery doesn't replace Botox and filler. So they can complement each other. So Botox in that neck muscle or around the jawline can help flatten things out a bit, and fillers can help tighten the skin a bit, but they're not going to do what surgery can do. And in the same token, if you want your jawline etched out more, you might need a little filler. So it's fine to do them together. I would say if you're planning to have surgery though, in the next 3, 6 months, maybe a year, I would hold off on any treatments in the neck just to minimize scar tissue.
Okay, good to know. Will I still be able to turn my head easily after the procedure, or does it feel different for a while?
Yeah, the most common overwhelming experience day one is that feeling of intense tightness, because that muscle is sort of just like corseted together. So you are going to feel tight in the beginning, which is honestly what we want, right? We want it to feel kind of tight.
That's what you came for.
That's what you came for. But you will be able to turn your head, no problem. It's just in the beginning, we don't want you doing a ton of twisting before that muscle kind of scars into place.
Amazing. Is there a rule of thumb to know if I need deep neck contouring versus skin tightening?
Yeah. So most of the time, the muscles of the face are very different than muscles everywhere else on the body. The muscles of the face attach from a bone to the skin, and the muscles, say your biceps, attach across a bone.
Right.
So anytime the muscles are lax, they will take the skin with them. And skin tightening might seem like you're just going after skin, but there usually is a muscle right underneath there that requires some manipulation. Okay. So if you're not ready for surgery, there are some nice skin tightening treatments, but if you want a particular outcome, then likely you're going for that surgical treatment. But, get all your options and figure out if they're in line with what you're looking for.
Amazing.
Yeah.
One other thing that I was really curious about, does it tend to be more women who are doing this or men, or is it equal?
I would say it's probably, at least in my experience, 80 to 90% women, just because of the field in general. But we are seeing a huge uptick worldwide, really, with men having these treatments done, because I think there used to be just more of a stigma around cosmetic treatments and men wanting them to have them done. But now it's a little bit more widely accepted. It's not taboo, and people sort of welcome aging in however you feel comfortable. Aging gracefully means something different to everybody. And so we definitely see our fair share of male patients.
What is one thing that you wish everyone knew about deep neck contouring or even surgery, plastic surgery, reconstructive surgery, before they went forward in doing it?
Yeah, I think it's always important to remember that these are medical procedures. So when you go into an office, you might be surprised at the treatments that are recommended to you, because you're coming in thinking that you want a particular treatment, but your surgeon may say you're not a candidate for this one and you're better off doing this other treatment. And although it can kind of feel like an upsell, I always say go in with your concern, not with like choosing a treatment. Just the same way you would do if you had a heart problem and you went to your cardiologist. You're not going to necessarily choose a valve over open surgery. They're going to choose for you based on expertise. And deep neck contouring has evolved so much over the last 5 years. I mean, we go to these academic meetings and we see every year how it's evolving and getting either more aggressive or less aggressive. And it changes so much. And then it's on social media and everybody knows about it. So yeah, it changes fast.
Thank you so much for joining us today on the Care Experts podcast.
Absolutely. Thanks for having me.
Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.